Hi everyone. Many people asked about the anticoagulation, oral anticoagulation doses according to the renal function. First of all, um, we usually do not calculate the doses for the people. If there is any issue, we ask the people, the hematology registrar, ask the other medical team to either consult the trust guidelines or trust protocols for the doses or ask the pharmacist. This makes our job easy. In daily life, we are not required to calculate doses for other people. The other people should know about the um, trust protocol. If they don't know, guide them that open the trust protocol for DOAC or dabigatran or warfarin. They should calculate the doses themselves. If they are not confident for this, then they should consult the pharmacist, and they will help them with the doses. But for the exam purpose, you need to know the doses of DOACs, dabigatran, especially these oral anticoagulation, according to the body weight and according to the renal function. So, first thing you should remember that renal function means creatinine clearance, not eGFR. You base the anticoagulation or DOAC's dose based on the creatinine clearance. So you should know how to calculate the creatinine clearance. It will be Cockcroft formula on MetCalc. You can open that in the Google, and then you can put the values, patient creatinine values and age, and they will give you what is the creatinine clearance of the patient. So for all for all DOACs, they are contraindicated if the creatinine clearance is less than 15. If the creatinine clearance is less than 15 ml then per minute, then you cannot use any of the DOACs. The bigatron, apixaban, edoxaban, and rivaroxaban, they are all contraindicated if your creatinine clearance is less than 15. Above 50, if your creatinine clearance is above 50, then you can use the normal doses in the patient, like the routine doses in the patient. No need to make the dose adjustment. Remember apixaban, if the creatinine clearance is about 30, apixaban is the only exception. Then you will give the normal therapeutic doses for VTE management. We are talking about anticoagulation in VTE management, not in AF. So if the patient has eGFR above 50, normal doses for dabigatran, normal doses for rivaroxaban and endoxaban. If the creatinine clearance is about 30, normal doses of apixaban as well. Okay. What When to use the low doses of the DOACs? When the um, when the creatinine clearance is less than 50 and above 15, then you will use reduced doses of the oral anticoagulation. Except again, here is the apixaban. In case of apixaban, if the creatinine clearance is less than 30, then you will use half dose or reduced dose of apixaban. So how I remember this for my exam? So I made a mnemonic for myself because I read it multiple times, and I wrote it in my registrar office as well and on my desk. I remember it. So Apex 30, rest 50. This mnemonic is in my mind, and now I have crammed it. It is whenever someone asks me that we need to give this patient DOAC, and how should we base the dose for this patient according to the renal function, I say calculate the renal function. If it is above 50, you can give normal doses of rivaroxaban, edoxaban, and dabigatran. If it is above 30, you can give normal dose of apixaban as well. And if the creatinine clearance is less than 50, you should give a reduced dose for edoxaban, rivaroxaban, and dabigatran. And if it is less than 30, then you should give reduced dose of apixaban only. And if the creatinine clearance is less than 15, then no oral anticoagulation. So apixaban 30, rest 50. Or you say apex 30, rest 50. This is my mnemonic for the oral anticoagulation to remember their doses. It's up to you how you want to make a mnemonic for the DOACs. Then you need to consider the weight of the patient as well, because if the weight of the patient is low in your patient, then you have to use lower doses. For example, in the edoxaban, I think in edoxaban, if the weight is less than 60 kg, then you have to use reduced doses, 30 milligram OD of edoxaban. In apixaban, you have to be careful as well, because if there are certain criteria. If two of the criteria are present, then you have to use a reduced dose of apixaban. Which is the one? Which are these criteria? The points are: if the age is above 80, age is less than, sorry, the body weight is less than 60 kg, and serum creatinine value is more than 133. Among these three, if you have two present, then you have to use low doses of apixaban as well. So if the age is above 80 plus uh, weight is less than 60, or creatinine clearance is more than the serum creatinine value is more than 133, then you have to reduce the value of dose of apixaban as well. So there are some factors on which you can dose the oral anticoagulation in VTE management. It is the creatinine clearance and the patient body weight as well. Okay. You should remember that for rivaroxaban and for apixaban, we have loading doses in VTE. In apixaban, we have 15 milligram BD once daily, twice daily for 21 days, and then 20 milligram OD for um, rest of the duration. Then in apixaban, we have 10 milligram BD for 7 days, and then 5 milligram BD for rest of the duration. In edoxaban, we don't have any loading dose. So that's why we give the patient low molecular weight heparin initially 5 to 7 days, and then convert to edoxaban. Dabigatran, there is no loading doses, but we can start directly from 150 milligram BD. Its low dose is 110 milligram BD. Now, what about the extremes of body weight? If the patient weight is up to 120 kg, the normal adult person, but when the body weight is on higher side and the weight is up to 120 kg, you can use any DOAC. Okay, there is no issue with that. And if the weight is between 120 to 150 kg, then you can use apixaban and rivaroxaban as well. No problem with that. But most of the trust in UK do not use edoxaban if the body weight is between 120 to 150 kg. What to do above 150 kg? So 2021 ISTH recommendation. If you find out the 2021 ISTH recommendation, it clearly says that weight is not a deciding factor in giving patient DOAC. You can give them apixaban and rivaroxaban for VTE management um, in the morbidly obese patient. Okay, if the oh, sorry, what about the edoxaban? No, edoxaban is not recommended in overweight patient above 150 kg. So the best choice that we have is the apixaban and edoxaban, or the alternative is warfarin. Previously, most people were not using DOACs above 150 kg, but now if the patient is above 150, you can use the apixaban and edoxaban as well. The deciding factor about the dosage of these drugs is again renal dysfunction and age of the patient. If they have renal dysfunction and creatinine clearance is affected, less than 50, in case of dabigatran, rivaroxaban, and edoxaban, you have to use reduced dose. If the creatinine clearance is less than 30, then you have to use reduced dose of apixaban as well. Less than 15 creatinine clearance, DOACs are not recommended. So these were a few points regarding the anticoagulation. You need to remember it only for the exam purpose. I would advise that if you are working in UK, your trust must have guidelines for the DOACs. Um, my trust has table for the DOACs, warfarin, everything. I'm working in Yorkshire. My main hospital is St. James Hospital, Leeds, and they have pathways for everything. If you are working in UK, your hospital must have these guidelines as well. I would advise you to open your trust intranet and write anticoagulation or DOACs over there. They will tell you. Regarding the low molecular weight heparin, it is trust to trust policy whether they use it, tinzaparin, or they use the enoxaparin or deltaparin. It depends which one they use. But and again, in overweight patient, the favorable low molecular weight heparin is the um, enoxaparin. You would have seen among your trust guidelines that if the body weight is above 170, convert tinzaparin to enoxaparin or discuss with hematology. This is usually recommendation. But I have heard from most of the people who are using tinzaparin or deltaparin in their trust. They say that we convert to enoxaparin when the body weight is more than 170 kg. Again, it depends on trust to trust. Better to open the trust intranet and see your trust recommendation and policy. So this was a small talk regarding the doses according to the renal function and the body weight. Remember the mnemonic for the exam purpose. Apex 30, rest 50. You can make your own mnemonic from Apex 30, rest 50. But for me, it is Apex 30 and rest 50. So this is on my mind. I dose the things like that. It is easy for me to remember both for part 1 and part 2 exam, and hopefully it will help you as well. Thank you.